Yeah. Oh, let the session finish. We will take questions in the end. We'll take questions in the end for this session. I just gave a feedback for the patient. So we have all 4 lectures. In that session finishes, we'll take the lecture. Questions.
Thank you, ma'am, for such an interactive and new modality exposure. I'm now going to be very privileged to invite Dr. Zania Zofra from the United States of America to speak on ablative lasers, rejuvenating of scarring vaginas, the truth unveiled. Ma'am, the guidance here.
Sir, mic on too.
Thank you very much for inviting me, Dr. McGowan and Professor McGowan. I'm thrilled to be here in India. And I'm going to give you a very different perspective than what you've heard before. And I have no conflict of interest, as you will find out from the lecture. This lecture is, I cannot run this. Okay, this is based on the review of over 390 recent articles. And now, women are the basis of the family. This is what holds the family together. The bonding of the family is because of women. So it's very important to satisfy them, and it's very important to empower them. Because unless we empower them, the entire structure of family is going to start falling apart. The way it does in the United States, so many divorces. So, lasers and also RF have a very simple solution, which is to thicken the womb. Okay? So there is a reduction in the economic benefit. And my question was, if collagen, because I said it's because collagen increases, and my question was, well, if collagen increases, and collagen is also involved in scar formation, would that mean, is it possible that the sensation of the woman is going to be reduced? So, is it possible that the laser vaginal rejuvenation is designed for men's pleasure, but it reduces the female satisfaction, the expense of the female satisfaction? So what's behind the female smile? Because women may smile, but there is something else may go on in the background. I wanted to explore that. So I'm going to bring you now inside the whirlwind of female emotionality, so you can understand better women. I see most of the audience are women, so collaborate. So again, this is based on research that we've done. This is also based on many books that have been translated on 12 languages, and several articles that I've written, and of course with other research that I collected for this presentation. So what we did a study, and we administered the MMPI to 14 menopausal women. We looked at only women that were extremely satisfied with their procedure, with the laser procedure, and the vaginal rejuvenation procedure. So everybody knows this is a way. We did not look at people that had complaints or side effects. We just looked at very highly satisfied women. And the women that had extremely high scores in the FSFI, which is an instrument that a lot of laser studies are using to prove that women are satisfied with the procedure. And what we did is we correlated the the lie scale, the depression scale, and the hysteria scale of the MMPI with the FSFI scores. And here what we found was that the FSFI had a very high correlation with the lie scale. What does that mean? These women were lying. So either they were denying and they were not aware, or they were just lying for. So they were lying. Sorry. And why would they lie? We'll find out in a minute. Then we looked at the hysteria and the depression scale, and they were also very highly correlated at a very significant level, 0.05. So on the outside, I think we're both there. On the outside, they were happy and they were laughing, but the inside was very different. There was hysteria, panic, and depression. So when it comes to women, nothing is as it seems, and this is what men have to understand. That the women are very complicated, are far more complicated emotionally than men. So there is a lot of exploration. What we also found, we looked at emotion scales, individual emotions, and we found there was a very high correlation between FSFI, that the high satisfaction questionnaire, with the emotion of shame. So the reason why these women were lying is because they were ashamed. What were they ashamed about? They were ashamed about that, they spent so much money in a procedure and they still have a problem. And so there is a caution to doctors that they have to understand that these self-report questionnaires do not reveal what's in the background, how women really feel, how women really experience themselves. So, men lie more, but women lie better. So, they know how to lie better, and they know how to fool men, because men are straightforward, women are very complex. So, they conceal the truth because they're afraid of disapproval. They may be afraid of dissatisfying the parent. They're happy that their partner is satisfied. So when they ask them, were your orgasms increased? They say, yes, they were. And they don't look at themselves. It's the orgasms of the partners that had increased. And they still will say, yes, I'm much happier. Or because basically they feel, what's wrong with me? I had this expensive procedure and I still don't feel any better. So, in the pursuit of happiness, women try to correct an emotional problem and a psychological roller coaster by basically altering the physical physique, the vagina physique. And it's a lot more than that we have to look at. And what we have to look at, that even with the perfect vagina, if there is hormonal imbalance, you're not going to have female satisfaction. Why? Because there's blocked energy. And why sexuality is energy. This is what Reich actually spoke about, Wilhelm Reich. He said that all pathology, not just physical pathology, but also emotional pathology, has to do with blocked energy, and that is blocked sexuality. So, what makes women insecure? Hormonal imbalance. It's the drama of hormonal imbalance. All the hormones go down with aging. DHA starts reducing from age 25, PMS, one drop in estrogen increases weight gain. So people get uncomfortable because of their weight. And I have a cartoon there. This lady started to cut her hair to reduce the weight. And estrogen decline is extremely important because this is what brings the need for the vaginal rejuvenation. And vaginal atrophy is, again, a problem as a result of that. And they have another cartoon that there is a reduction of women allowing for sexual intercourse. So, hormonal balance is what's going to give women confidence, not just the vaginal rejuvenation. So that is another thing that we have to understand. So, a laser procedure or any procedure will not affect the hormonal balance. So the promise is that you're going to get happier. However, the question is, can just increased collagen increase hormonal balance? And actually, it's the collagen deficiency. In other words, say that there is not enough collagen in the system because of estrogen problem, then how can the system produce more collagen? Then there is no hormone. It's a sort of an interaction between the hormones and everything else. And this is all references of the people that are saying that. You know, there's a lot of research on that level. So hormonal imbalance, when we talk about that, we're stepping into a shaky ground. And we're talking about the collagen miracle. Everybody talks about collagen like it's the miracle of miracles. In fact, collagen is only one out of 100,000 proteins that contribute to this balance. So it's not just lack of collagen, it's lack of protein homeostasis, what we call proteostasis. This is what we need to understand. Collagen alone is not the problem. The problem is imbalance. And of course, there is a lot of psychological aspects. And another problem is that a lot of these studies that you read, they claim significance, statistical significance, where there is none. And I've been through many of these studies, and I'm going to give you one example. This study reports that sexual life significantly improved by 0.001, but when you look at the results, only 85% were sexually satisfied. They actually say that in the article, which is 0.15%. That's not significant. It's not 0.0001. It's 0.15 actually. And then you look at 26% of these women were not sexually active. So how did they assess the sexual satisfaction of women that are not sexually active? So when you look at the results of a lot of these studies, what you find is that a lot of published research is not giving all the information that they should be giving you. So that's something that is a very important consideration in today's publications in science. Now, if there is no statistical significance, you do not have external and internal validity, which is very important for science. And you basically, other problems with the laser research is that it does not assess the quality of life, it does not consider the complexity of endocrinological communication, hormonal balance, health status, emotional issues, lifestyle, etc. So there is a lot of lack of scientific data on the efficacy of the technique. And there's another presenter before, she's sitting right there at the front now, that she spoke about that these technologies are not FDA approved, they're not. So, absence of good quality prospective randomized clinical trials to provide efficacy and safety data, and unknown distal effects of what happens in rectal areas. All these have not been examined. And it's not, that's another article, says there's no convincing data, laser is not recommended. And don't get me wrong, lasers have a place, okay? Because there is a place where women need it, but these technologies have been overused. Women just go and say, well, let me have vaginal rejuvenation, when they don't really need it. So, and there's time for a pause for the use of it. In other words, they should be used where they have to be used, but not just abandonedly as they are at the moment. And they're not approved by the FDA. There are complications such as fibrosis, carrying urinary issues, as well as other side effects. So a lot of federal agencies have given now warnings against laser procedures, and the majority of patients, of these patients that they looked at, they had to get urgent care, neurology, gynecology, urology, gastroenterology, and 33 patients indicated chronicity, long-term pain, numbness, burning, bladder disturbances. You already know all this, and I'm sure you are careful in avoiding them. Now, there are other technologies that have been underexplored that basically have to do with resonance and energy flow that have come. There are technologies that are based on cellular research primarily, and they are basically. Oops, I don't know what happened here. I think I pressed something wrong. I apologize about this. So these technologies are basically have to be with Fred, and it's just my window doesn't work very well. Okay, so they have to do with resonance. There are energies below thermal, so there is no sensation at all. And of course, there's no pain. They're very comfortable. And it's based on research by Wilhelm Röntgen, came out in 2005, that at these energies, the ion channels of the cells open up the way you open up your garage door. You don't know why. This is what happens. And what you see, also, these technologies use a timing issue. And as you can see, this is the Nobel Prize 2017, quite recently, on the timing of how timing the cells can change a lot of things and a lot of can prevent functions. This is how energy transfer, you can see a protein, how it changes its shape through the energy transfer that happens through resonance. These are all new technologies that probably 4 or 5 years now that they have started really developing and coming out. So they're very, very new. And you can see now energy transfer. This is the microscope. As you can see, the Fred is extremely complicated microscope, very expensive to kind of observe this research. So females need a gentler approach. Most females do, unless there is a serious case of deformity that needs intervention. But they need a gentle approach. So, and female satisfaction is based on understanding. We need to explore what women want, not just hear what they say. What they say is what they think that they have to say. What they have been taught by their mothers in society to say and express. It's not always what they really feel. So you need to be able to explore that. And that is basically the message I'd like to leave you with. Thank you very much.
Many lines
So the next speaker in line is Dr. Rashmi Chahat. She speaks as the last speaker in the MCAS session, but nevertheless one of the most important pillars behind Recombine 2024.